What is the cytokine storm in post-viral chronic fatigue? A cytokine storm is an extreme immune response where the body releases an overwhelming amount of pro-inflammatory cytokines. These are small proteins that play a key role in regulating immune activity and inflammation. When this response goes unchecked, it can lead to significant inflammation and damage to tissues throughout the body. In the context of post-viral chronic fatigue syndrome, also known as chronic fatigue syndrome or myalgic encephalomyelitis, the idea of a cytokine storm relates to how the immune system behaves after a viral infection. Some viral infections, like COVID-19, can trigger an unusual cytokine response. This response may lead to ongoing inflammation, which is linked to symptoms of chronic fatigue, such as extreme tiredness, muscle pain, and difficulties with thinking and memory. However, it is crucial to understand that a full cytokine storm, which is a severe immune overreaction seen in acute infections, is not typically a characteristic of chronic fatigue syndrome. Research shows that people with chronic fatigue syndrome often have altered cytokine profiles. Some pro-inflammatory cytokines may be elevated, but not to the extreme levels associated with a cytokine storm. These changes indicate a chronic and dysregulated immune response rather than an acute storm. To break it down further, cytokines are essential in managing immune and inflammatory responses. Studies have indicated that individuals with chronic fatigue syndrome have increased levels of specific pro-inflammatory cytokines and changes in how their immune cells communicate. This may reflect ongoing immune dysfunction triggered by a previous viral infection. A cytokine storm usually refers to a sudden and massive releases of cytokines that leads to severe inflammation and potential organ damage. This is often seen in acute infections or during certain immune therapies. In contrast, post-viral chronic fatigue syndrome involves a more subtle and persistent immune imbalance rather than an acute storm. In cases like long COVID, a cytokine storm during the initial infection can result in lung damage and serious illness. However, the chronic fatigue symptoms that follow are believed to stem from lingering immune dysregulation and inflammation, not from ongoing cytokine storms. In summary, while a cytokine storm is an intense immune reaction that can happen during some viral infections, in post-viral chronic fatigue syndrome, the immune system shows altered cytokine patterns that indicate chronic immune dysfunction. This dysregulation likely contributes to the persistent symptoms experienced by those with chronic fatigue syndrome. Understanding this difference is vital for recognizing how immune system issues relate to chronic fatigue without confusing it with the acute and severe cytokine storms seen in other conditions. Always consult healthcare professionals for personalized medical advice regarding these complex issues.